We care heavily about the emotional piece of the postpartum and specifically how that relates to lack of sleep. We feel that oftentimes postpartum depression and some of the other postpartum mood disorders are brought on by a lack of sleep and a lack of support, quite truthfully. We live very differently than we did a few hundred years ago with our extended families and lots of support. That support goes on and on for 6 to 8 weeks postpartum, including midway we check in with the family. How are things? How is the baby doing at this point? Did all the testing come back normal? Is it growing appropriately? Or is nursing off to a good start? Or do we have to mitigate a tongue tie or milk transfer issue? The testing that has to happen for the baby between 24 and 48 hours of age often is what keeps the family in the hospital setting, where here we trust you to bring the baby back to the birth center in that 24 to 48 hour time period. At that time, we're evaluating how the newborn is adapting to life. Are they nursing it properly? Are they eliminating well? How are they integrating into the family? What is their neurological status? How are their reflexes intact? Are they warm? Are they stable? Are they waking up and opening their eyes and being a part of life? And the postpartum person also, we have to make sure that there's no fever and their bleeding is under control and that their breasts are not beat up or that they're feeding the baby appropriately and they feel okay about those choices. And then ongoing into the postpartum for well body care and family planning and considering nourishing the body for the postpartum, including assessing the pelvic floor and the diastasis, so where the abdominal muscles separated. We focus heavily on that because that impacts the long-term health of that person forever.